To start off with, I have no disclosures, and my objective here are really to just teach you about this class. We are all in the midst of the opioid epidemic and trying to figure out a way to teach our medical students and give them tools that they need to be able to take care of these patients. So this is what we do in our class. But to start, we're going to take a little blast into the past. Oh, it didn't work. Hold on. Yeah, that would be super. Well, the sound is not there, but I can sizzle, sizzle, sizzle. And how many of you remember this commercial? I bet you can actually, there you go.
Any questions?
I don't think we actually need the talking, because I think we probably all remember this commercial. This is your brain. This is your brain on drugs. It was something that I grew up with, and I'm sure many of you probably remember that commercial as well. I'm going to try to skip ahead here. So unfortunately for me, that's like largely what I remember of learning about drugs and addiction growing up and throughout high school. And I'm sure that I learned something about addiction in medical school, but unfortunately it really did not stick. And so somehow I found myself in a role as a medical educator in charge of teaching our medical students at Vanderbilt about addiction and pain addiction, opioids, and policy. And I suspect many of the students that we teach are similar to this student who wrote, this is gonna be hard because I've animated it, but I'm gonna read it because I don't have a screen here. But I have a bias and a prejudice against people struggling with addiction. During my second and third year, when I spent time on the addiction psychiatry and chronic pain services, I often found myself growing frustrated with patients. I wondered how they could let this happen to them. Don't they know they're making life more difficult for themselves and those around them? It was then that I realized that I saw addiction as a personal and moral failing. So I think that probably represents a lot of students and a lot of people in our communities, unfortunately. So we are doing our best through this class to destigmatize opioid use disorder and patients who are suffering from other addictions as well. Here we are, unfortunately, in 2022, the opioid epidemic is only getting worse over time. COVID certainly didn't help that. And we at Vanderbilt are located in Nashville, Tennessee, which, as you might know, is right in the heart of the opioid epidemic. And in fact, 1 in 6 Tennesseans is likely suffering from either misuse or abuse of opioids or getting treatment for their addiction. So this class was really created out of to fulfill an unmet need at our institution. And with those numbers, you can imagine that any physician in any medical specialty is going to be caring for patients with opioid use disorder in the future. So we really wanted to reach all of our students and give them tools that they need to be able to care for them, but also tools that they can use to advocate for them moving forward, regardless of where they end up in the country and regardless of their specialty. So our class is an elective class. It is for students in their 3rd and 4th years of medical school. It's in what we call the immersion phase of the curriculum. And it's in what we call an integrated science class. Integrated science classes are somewhat unique in that they combine both classroom-based learning and workplace-based learning, trying to balance those things out and bring them together so that the classroom informs the clinical aspects of things, and it really leads to better patient care overall. So our curriculum is made up of different learning modalities. We have didactics, guest speakers, hands-on sessions, a book club, this is a little slow, sorry, clinical experiences, and then finally student-led discussions. So we'll start out with our didactics. In the interest of time, I'm not going to go over all of these things, but we have some that are dedicated specifically to addiction, others dedicated specifically to pain, and then others that cover both pain and addiction. And while our didactics traditionally have been like lecture-based, but lectures are boring, and as the Guardian says, they are lazy and damaging pedagogy. So we're trying to get away from that by incorporating other things like podcasts, and you'll see some familiar faces here. There's some really amazing podcasts out there that do a much better job of talking about these topics than I ever could through my lectures. So we incorporate that. And then the lectures and kind of the focus on fundamental science, basic sciences, inform our hands-on sessions as well. So we have a session on quantitative sensory testing where we talk about the transmission of pain signals, how we can potentially objectively manage pain and the challenges associated with that. We always pit the girls against the boys, which is always very fun to see who has a higher pain threshold. We also have a motivational interviewing session with our addiction psychiatry colleagues. So I will say that this is a class that is kind of co-directed by me from anesthesia and pain management, and then our psychiatry colleagues in addiction psych. And it's a really beautiful relationship that we have working together to direct this class. So they help with the motivational interviewing session. We have our pain psychologists lead a session on cognitive behavioral therapy and mindfulness, and they discuss not only the science behind it, but they also lead our students in sessions on mindfulness and cognitive behavioral therapy, which I think provides them with tools that they can use moving forward when life inevitably gets tough, especially when they enter residency. And then finally, we have a session on traditional Chinese medicine and acupuncture led by Dr. Zhu, who is trained in traditional Chinese medicine. He talks specifically about the evidence behind acupuncture and the role that acupuncture can play in opioid tapering. And then he does a hands-on session with our students so they get to experience acupuncture if that's not something they've experienced in the past. Our probably most popular hands-on session is our visit to the Davidson County Drug Court, or DC4. DC4 is a residential drug court. It was the first residential drug court in the country. It is essentially a 2-year program. It's based on 12 steps. All of the residents at drug court are convicted felons. They're all nonviolent offenders who are convicted on drug charges. They spend 2 years living at drug court, and it is an incredibly intensive experience for them. And then when they graduate from the program, they serve the rest of their sentence on probation. This, to me, is probably the most moving experience for our students. We hear the stories of some of the residents, and as you can imagine, they tell their stories that are unlike anything that I've ever heard before. The amount of trauma that these people have experienced, the amount of stigma that they feel, the lack of support and encouragement and hope that they really lack from the community, I think is really moving to our students. We also get to kind of see the work that they do and tour the facility, and then we listen as the judge runs the docket and checks in with all of the residents. So it's a really cool visit for us. So I also have some really great guest speakers who join us for the month. Many of you have probably heard of, if you haven't seen, the Hulu series Dope Sick, which is based on the book by Beth Macy. Michael Keaton plays the physician in the series, and while we don't have Michael Keaton visit us, we do have our own Steve Lloyd, who is a physician suffering from addiction, and his experience serves as the basis for Michael Keaton's character in that series. So Steve Lloyd comes to talk to us about his experience and now his work with Cedar Recovery in Tennessee. Oh, I set a timer and I'm not sure. I didn't actually set it, apparently. So he is also politically active and talks to us about his experience in the political arena as well. Michael Barron is the director of the Tennessee Medical Foundation. He speaks to us specifically about the evolution of policy regarding opioids, how we got to where we are, and how we can potentially help moving forward. I think Michael Barron also talks to us about the Physician Assistance Program, which is a program for physicians with mental health or addiction problems, and it allows the students to know that there is a free and anonymous resource available to them should they suffer from addiction or mental health issues themselves. And then finally, we have my friend Skylar Clayton come talk to us. I'm not sure where to point this thing. He is one of our recovery coaches in the Vanderbilt Addiction Services. He has suffered from addiction himself and now works as a recovery coach to guide to walk alongside those who are in recovery. So he speaks to us about his own personal struggles with addiction, his failures to remain abstinent, and kind of how he is moving forward on a day-to-day basis. So these gentlemen all have unique perspectives on opioids, pain, addiction, and policy. And I think they really kind of inform a broader picture for our students. Our students have about 3 half days of clinical experiences every week. They are all required to spend time at our interventional pain clinic, on our chronic pain service, with the addiction psychiatry inpatient consult service, and then with me at the Bridge Clinic. This is our Suboxone initiation and stabilization clinic, a multidisciplinary clinic. I'm the pain doctor there. They also can choose some from other clinical experiences based on what their expected specialty is going to be or what their interests are. And these things include pediatric pain, women's health, which is kind of GYN psych combined, the cancer pain clinic, Cedar Recovery with Steve Lloyd, our spine clinic, and then the Firefly Clinic, which is a special clinic for pregnant women and new moms who are suffering from substance use disorders. We also have a book club every Wednesday afternoon. We jointly read this book called American Overdose by Chris McGreal. He has written a really phenomenal book about kind of the political aspects of the opioid epidemic, specifically how big pharma influenced individual doctors, Congress, the FDA, pain societies. And we really take a deep dive into kind of the things that built the epidemic into what it is today. And then finally, we have student-led discussions, and we have these on Friday afternoons. Everyone is kind of unique. The first 2 weeks, we discuss clinical cases that the students bring to us, either about addiction or pain. And we discuss kind of the epidemiology, the pathophysiology. And then I just really encourage them to go down rabbit holes. Whatever interests them will probably interest the rest of us, and they bring their interests to us. On the third week, I have them imagine what it would be like to be one of our patients in the Bridge Clinic. And these patients are unstably housed, almost universally uninsured. Most don't have a cell phone. Most certainly don't have cars. And a lot of them lack IDs. And so imagine what it would be like to be one of those patients seeking recovery. So I have them call outpatient clinics, residential facilities, see what the cost would be, what the requirements for admission would be, whether they take people on medications for opioid use disorder, and then whether or not they have grant funded beds available. And it kind of gives them a glimpse into how hard it can be to get treatment, even if you are motivated and want help, but don't have resources. Our last two, we have opioid abatement strategies that we speak about. So we look at the evidence for various opioid abatement strategies, and then talk about where we would allocate the funds from the various opioid settlements that are kind of coming in continuously. And then finally, we have a discussion with Dr. David Edwards about becoming policy entrepreneurs. We learn about what does it mean to be a policy entrepreneur? How do we do this? And then how do we use what we've learned in the class to advocate on the behalf of our patients? So our hope is that we kind of put all these things together, build a picture that informs what it's like to live with pain, what it's like to live with opioid use disorder, and how we as clinicians can help those people. Really, we're trying to put the pieces of the puzzle together, give our students kind of the framework for putting those pieces together, and allow them to join with each other, join with our patients, and hopefully the heart of the opioid epidemic here will then become the heart of healing and hope for our patients. Thanks.